We all know keeping our blood pressure in check is vital for a healthy heart. I mean, that's been drilled into us for years.
Yeah, definitely.
But what if that same number is actually just as critical, maybe even more so, for keeping our brains healthy?
That's exactly where the research is heading. It's fascinating.
So today we're going deep on this connection between blood pressure and, well, our cognitive function. We'll explore how managing one can really impact the other, potentially protecting us from more than just heart problems down the line.
Right. The focus used to be almost entirely cardiovascular,
Hmm.
but the science now really points strongly to this link between circulatory health and, long-term brain well-being.
Okay.
So our mission here is to unpack the key research, the studies that show this connection, and figure out how managing your blood pressure could be a powerful tool for brain health as you age, maybe even lowering dementia risk.
And we've got some solid stuff to look at, mainly findings from major scientific studies that have really pushed this forward.
Exactly. Key trials.
Okay, let's jump right in then. How specifically does high blood pressure actually harm the brain? It seems so delicate.
It is delicate. And the chronic, sustained pressure from hypertension really takes a toll. It mainly hits the brain's network of blood vessels, particularly those tiny arteries, the really small ones deep inside.
Like a plumbing getting stressed.
Kind of, yeah. Think of it like a super fine irrigation system. If the pressure's constantly too high, those delicate channels get worn down, damaged.
Okay, and what happens then? What are the actual, consequences?
Well, a few things. First, you get reduced cerebral blood flow. Basically, less oxygen and fewer nutrients getting delivered where they need to go for the brain to work properly.
Hmm.
When that flow is compromised, cells don't get what they need. Then you see more oxidative stress and inflammation. Think of it like internal irritation or rust at the cellular level.
Right.
And importantly, high blood pressure can cause the blood-brain barrier to break down.
I've heard of that. That's the brain's filter system, right?
Exactly. It's super selective, normally protecting the brain from nasty stuff in the blood. When it weakens, things can leak through that shouldn't.
That sounds like it could trigger a whole mess of problems.
It really does. It's a cascade. These things speed up neuronal aging. The brain cells literally age faster, and they mess with the brain's ability to clean out waste products, do its housekeeping.
Wow.
Over time, this can cause conditions like small vessel disease, and you might see white matter hyperintensities on brain scans.
Okay, what are those exactly?
They're basically signs of damage, little spots often affecting the connections, the wiring between brain regions. And we know these are linked to cognitive decline and a higher risk of dementia later on.
So it's not just the big sudden stroke risk, but this slow kind of grinding damage we need to worry about too.
Precisely. It's insidious.
Now, this brings us to some really important research, doesn't it?
Yeah.
Big studies that sort of shone a light on this. Let's talk about the SPRINT trial first.
Absolutely. The systolic blood pressure intervention trial was huge. Landmark, really. Over 9,000 adults, all at high risk for heart problems.
Okay.
And they split them up. One group aimed for a standard blood pressure target, systolic under 140. The other group went for a much tighter target, under 120.
And the first results were all about the heart, and they were pretty dramatic, right?
Oh, yeah.
Yeah.
Really impressive. The group aiming for under 120, the intensive group, had a 25% drop in major cardiovascular events, heart attacks, strokes, that kind of thing.
Wow, 25%.
And maybe even more striking, a 27% reduction in death from any cause. It was strong evidence for tighter control having big heart benefits.
But it didn't stop there. That led to SPRINT Mind focusing on the brain.
Exactly right. Sprint Mind was the follow-up, looking specifically at cognitive outcomes in those same people, and the results were, well, very encouraging.
Oh, so.
The folks in that intensive under 120 group, they had a significantly lower risk of developing mild cognitive impairment, or MCI.
Okay, MCI, that's like a precursor stage sometimes to dementia.
Often, yes. It's a noticeable decline, but not severe enough to be dementia. Now, interestingly, there was also a trend towards less dementia in that group, maybe 14 to 19% lower risk.
A trend, meaning?
Meaning it pointed in that direction, but it didn't quite hit the threshold for statistical certainty. It wasn't definitive proof for dementia prevention, but it was certainly suggestive.
Still, pretty compelling, though. Lowering MCI risk is significant in itself.
Absolutely. It's strongly hinted that aiming lower with blood pressure could have real cognitive pluses, reducing MCI and potentially just maybe dementia risk too.
Okay, so that's sprint. But you mentioned newer research too, something more recent from China.
Yes, a very large study published results in 2024, generating quite a bit of buzz. It involved over 34,000 adults aged 40 plus in rural China.
That's a big cohort. What do they compare?
They compared standard blood pressure management with a more structured approach, specifically designed to get systolic pressure below 130 millimeter Hg. It's interesting because it's a different population, potentially different diets, different setting.
Right. And did the structured approach work? Did they get the numbers down?
Oh, yeah. The intervention group saw an average drop of 30 millimeter Hg in their systolic pressure. That's substantial. The control group only dropped by about 8 millimeter Hg on average.
30 points. That's a huge difference. So what was the impact on dementia rates?
Well, here's the headline finding. Over the 4 years they tracked them, the group getting the intervention, aiming for below 130, had a 15% lower risk of developing dementia compared to the standard care group.
15% lower risk of dementia. That's pretty significant.
It is. Now, we should add the usual caveat. This study is still making its way through the full peer review process and wider scientific scrutiny.
It's your standard process.
But if these findings hold up, it could be a major step forward for public health, particularly in thinking about dementia prevention strategies.
It really reinforces that sprint finding, doesn't it? That actively getting blood pressure down helps the brain, which makes you wonder, when should we start worrying about this? Does it matter if your pressure creeps up in middle age?
That's a fantastic question, and the evidence increasingly says yes, absolutely. Early intervention seems key. What happens in your 40s and 50s really seems to matter for your brain decades later.
How so?
We're seeing data showing that even pre-hypertension in middle age, systolic between 120 and 139, not quite high, but not optimal either, can have negative long-term effects.
Really? Even that range?
Yeah, there was a study back in 2014, I think it was, in the journal Hypertension. It followed people long term.
And what did it find?
It found that women who were in that pre-hypertensive range during middle age showed more cognitive decline 10 years down the road compared to women with lower pressures midlife.
Wow. So even slightly elevated pressure over years adds up.
Exactly. It speaks to this idea of silent cumulative damage. It's not just about dodging that big stroke later in life. It's about the gradual wear and tear from consistently higher pressure impacting how well your brain works over time. It really makes the case for being proactive, throughout adulthood.
Okay, this is really shifting the perspective. So given all this, what should our actual blood pressure target be? It feels like the goalposts might be moving.
Well, it's definitely nuanced, and it's crucial to say this up front. Targets need to be individualized. You absolutely have to talk to your doctor.
Of course.
But based on sprint, for people already at high cardiovascular risk, aiming closer to that under 120 systolic mark might offer more protection for the brain too, potentially. But again,
Needs careful medical supervision.
absolutely, it's not something to try on your own, as lowering pressure too much or too fast can have risks too.
So what are the general guidelines most doctors are working with now?
The big cardiology groups, like the American College of Cardiology and American Heart Association, generally recommend aiming for below 30/80 for most adults with hypertension, especially if you have other cardiovascular risk factors.
A low 30/80.
Yeah. But the bottom line really is that conversation with your doctor. They know your history, your risks, and can help set the right goal for you. It's not one size fits all.
Makes sense. So we know lowering it is good. What can people actually do? It's not just pills, right? Lifestyle must play a huge part.
Oh, a massive part. Lifestyle changes are often the very first step. You've probably heard of the Diapia-H diet, dietary approaches to stop hypertension.
Right. Fruits, vegetables, whole grain.
Exactly. Lots of those. Low-fat dairy.
Mm-hmm.
And then there's salt or sodium. The American Heart Association suggests less than 2,300 milligrams a day, ideally.
Which is about a teaspoon, right?
Roughly, yeah. And they say aiming even lower towards 1,500 milligrams is even better, particularly if you already have high blood pressure. It's tough. Salt is hidden everywhere.
True. What about exercise?
Hugely important. Regular aerobic activity, brisk walking, swimming, cycling, anything that gets your heart rate up can lower systolic pressure by a good 5 to 8 points.
That's significant just from exercise.
It is. And managing your weight, even losing just 5 or 10% of your body weight if you're overweight, makes a difference. Plus, the other usual suspects. Limit alcohol, definitely don't smoke, Try to manage stress, get enough sleep. It's all connected.
It's the whole package for overall health, really.
It really is. Brain health, heart health, they rely on the same foundations.
Okay, those are the tried and true methods. But wasn't there also some interesting research on, like, salt substitutes? A more novel approach?
Yes. The ASAS study, salt substitute and stroke study, also out of China, actually.
Okay, what did they do there?
They looked at replacing regular salt sodium chloride with a substitute that was enriched with potassium chloride. The idea being you reduce the sodium but increase potassium, which can also help blood pressure, especially relevant in places where people eat a lot of salt and maybe not enough potassium-rich foods.
Interesting swap. Did it work?
The results were pretty striking. The group using the salt substitute had a 14% lower risk of stroke.
14%,
Yeah.
just from changing the salt.
Yeah, and a 13% lower risk of dying from cardiovascular causes, and a 12% lower risk of dying overall.
Wow.
It suggests that this kind of simple dietary switch, potentially quite low cost, could have a really big impact globally, especially in high salt regions.
That's fascinating. A simple pantry swap with potentially huge benefits.
Wow.
Okay, so as we bring this all together, what's the core message? The main thing you want people listening to take away from this deep dive?
I think the biggest takeaway is this. Being proactive about your systolic blood pressure, especially if it's creeping up over 130, isn't just about your heart anymore. It's profoundly important for your brain health too, long term.
Right.
The evidence from big trials like SPRINT and these newer studies like the one in China strongly suggests that getting that pressure down through appropriate means for you can significantly cut your risk of heart problems and cognitive decline, including MCI and maybe even dementia.
And it's a combined effort, not just one thing.
Exactly. It's the synergy. It's combining that careful blood pressure management, which might involve medication for some, with consistent, healthy lifestyle choices. Diet, exercise, sleep, stress management, and regular monitoring. That's key for keeping your brain in good shape as you get older. It's a holistic thing.
This has really hammered home just how linked our heart and brain health are. It's not separate systems operating in isolation.
Not at all. They're intimately connected.
So a final thought for everyone listening. How closely are you paying attention to your blood pressure numbers right now? Thinking about everything we've unpacked today, could making some small, deliberate changes be one of the best investments you make in your future cognitive well-being? What's one step you could explore?